So the next part of the prac is trying to elicit the flexor reflexes. So in particular the plantar reflex on the sole of the foot and also the abdominal reflex on the abdominal region. So to do this you use this spiky end of the tendon hammer. So this isn't a stretch reflex, it's a nociceptive reflex, so it's a response to withdrawal from a painful stimulus, mechanical stimulus. So we're actually not going to demonstrate this one. There's already good videos up through CuraCloud that demonstrate this response. The plantar reflex is a fairly common clinical reflex to test. You know, it's associated with the Babinski sign, so you'd usually expect the toes to curl inwards, but in some people with certain motor impairment, the toes will actually curl in the opposite direction and curl outwards. You see that a lot in babies, it's perfectly normal, but in adults, that's called the Babinski sign. Okay, so in this example of the corneal reflex, which is one reflex, or the flexor reflexes that we're going to test, again, like the other two flexor reflexes, it's really about a withdrawal from an irritating or painful stimulus, this time in the eye. So what we're going to do in this case is take a piece of cotton wool and just manipulate it so you get a fine little cotton wisp that can irritate a certain part of the eye. So again, Tara is going to demonstrate this, and what I'm going to do in this experiment is touch on the cornea, which is the pupil and the iris, and then also touch on the sclera, which is the white part of the eye. When we actually do this experiment, you'll see that touching on the cornea elicits a blink reflex, whereas touching on the sclera doesn't. So what this really means, and the reason for this, is that we do have these nociceptors on the cornea, but they're completely absent from the sclera. So we touch the corneal, that nociceptive stimulus is perceived, and you get a blinking reflex, whereas when we're touching on the sclera, no nociceptors there. There's no signaling going to the spinal cord and the brain to inform it of that stimulus, and so we see no response. So that's the corneal reflex.